The current generation of CAR T-cell therapy shows that it cures, at least in the case of lymphoma, probably it induces durable remissions in about 40% of the patients, but 60% of these patients fail. So I think one of the big questions going forward is what are the main mechanisms of resistance in those 60% of the patients who fail CAR T-cell therapy, and what can we do to further improve outcomes in these patients? When we started analyzing the tumors in these patients, we found that probably about half of these patients can have antigen escape due to CD19 loss. So one way to address that is to target other antigens such as CD20, CD22, or BAFF receptor. And at this meeting, there are abstracts being presented looking at CAR T-cell therapy against a BAFF receptor. And then the other half of group who have a CD19 positive relapse, there's emerging evidence suggesting that impaired T-cell fitness might be a mechanism of resistance. So we need to think of various strategies to improve the T-cell fitness in these patients, which may be affected either because of the chemotherapies that these patients receive, or because of the disease itself. So one way to think about addressing the impaired T-cell fitness is to use an allogenic source of the T-cells, and that might improve the efficacy in this patient, but there are also other ways to address it. So for example, in the case of CLL patients, giving ibrutinib before the apheresis has been suggested as a way to improve the T-cell fitness, and also other agents such as PI3 kinase inhibitors and lenalidomide may also improve T-cell fitness in these patients, and are strategies that are being explored in the clinic.